Joining us now, Dr. Robert Murphy, professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
Well, let's start with this mask requirement. No doubt you've seen some of these heated school board meetings where parents are yelling at the school board. What are your thoughts on students wearing masks?
Well, there's basically three camps. There's the camp of the American Academy of Pediatrics, which is a very cautious group, and they're recommending everybody in schools wear a mask and stay 3 feet apart. Basically the strictest. Centers for Disease Control is saying that if you're vaccinated, you don't have to wear a mask, and so the kids will be wearing masks, but the staff pretty much will not. And then there's the group that just doesn't believe in any of this stuff. And so, you get to pick your choice. Here in Chicago, CPS is going with the American Academy of Pediatrics. That's the safest way, I think, especially since the cases are increasing so quickly now. The Archdiocese of Chicago is taking the CDC route and saying vaccinated people don't have to wear it. So that's the status right now.
What do you think about this, the Delta variant and Johnson & Johnson vaccines? There was some talk about that maybe they're not as effective. Your thoughts on that if people are worried?
Yeah, no. So right now, I think let's be clear. The Delta virus, all the three vaccines that are available now work against the Delta variant. What you're referring to, Robin, is a laboratory study done at NYU in 27 donors who had a specialized blood test to measure the immunologic response, and with Delta, the vaccines have a lower amount of neutralizing antibodies. The Johnson & Johnson was lower than the Moderna and Pfizer. That's what this is all about. It's a laboratory study in one lab. Other labs have found different results. So, and just as recently as a week ago, there was another lab study that was supported by Johnson & Johnson, of course, because they developed this vaccine at Harvard. And they found that there was great activity in the whole immune system response to the J&J vaccine up to 8 months. So, it's all over the place, but those are laboratory studies. You look in the hospital and stuff, you're not seeing lots of J&J vaccinated patients.
What about before we get to the viewer questions, what about these breakthrough cases, people worried if they are vaccinated, if they could still get COVID? What are the percentages there? Remind people.
Yeah, so, none of this stuff is 100% for protecting you from getting COVID, but it's almost 100% protecting you from going in the hospital or dying. So, it's two different metrics that we have there. And so if you look at the hospitalized patients, 90 to 95, in Illinois, it's 90% of the hospitalized COVID patients are unvaccinated. In other states, it's as high as 95% or even 99%. So, you eliminate the really serious people. So nothing's 100%, but you will cut the death rate almost to zero if you get vaccinated.
All right, our first question here continues with this theme here. How can we who have been vaccinated avoid getting COVID, especially since we can't get a booster yet? Also, will the booster just be another dose of the same we received with shot 1 or 2?
Yeah, no, this is really, really a good question. And this is where I'm sure the people at CDC now are thinking, well, we got to change some guidelines here. And this is what LA County has done. In other words, they're saying indoors, everybody wears a mask now because there's just so much going on. They have a 20-fold increase in cases in the last month alone. And so they've gone backwards in the whole masking and social distancing thing, because then you even have a lot of people who are vaccinated getting sick. Now, granted, they don't end up in the hospital or die from it for the most part. But that's where this whole masking thing comes along. The second part of the question: will a booster dose prevent that? Right now, we don't have any data that suggests that it would in a person who is not immunocompromised. Where those studies showed the booster helped in Israel and in France, those people had underlying cancers and organ transplants on high-dose steroids. They were really immunocompromised people. There, the laboratory data suggests that a booster dose is really effective, and that's what the Pfizer has applied to modify their EUA for that group only, not people in general.
All right, next question. When will Moderna be available for 12 to 17-year-olds? I thought they submitted for approval in early June.
Yeah, they did. And, they should be hearing really any day now. But, there's so much data. It's thousands of kids that receive that Moderna dose. So they're reviewing it now. It could be any day. But right now, kids can't get the Pfizer. So they should get that if they're interested in getting it, or wait a couple more weeks, and the Moderna one will be out.
Okay, if you didn't get your question answered, Dr. Murphy answers them bi-weekly on Northwestern University's Institute for Global Health Facebook page. You can also submit questions via email or go to our Morning News Facebook page and post one there. We'll talk to Dr. Murphy again on Monday. Have a good weekend.
Have a great weekend.
Hey,